Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. So, The Social Doctor is all about a platform for the doctors by the doctors. It's about discussing the journeys and experiences of successful medical practitioners. And today we have Dr. Parvinder Kaur with us. She post her MBBS, did her MD in Gynae and Obs, and has been practicing since the last 13 years in the field. During her practice, she has practiced with some of the leading private and government hospitals in Delhi NCR. And right now, currently, she's working as a consultant in Artemis Hospital. Welcome, doctor, on the platform. How are you doing these days?
I'm good, Ayushi. Thank you for inviting me to this platform. I'm really glad to be here because this is a much needed platform because we tolerate about everything that what we have to do in next life, what is the next step. And that ignorance leads to wastage of so many years sometimes. So I think that this step is much needed.
Yes, I completely agree. It's very important for us to get guided by our seniors and people who have already crossed their path and experienced so much and crossed their hardships.
Yeah.
Tell us about yourself. How has your journey been till now in the field?
See, I was never from a medical background. In my family there was no medical professional working there. Okay. So I passed my MS from SMS Hospital in Obstetrics and Gynaecology in year 2009. Okay. Then as people told ki SR-ship karna chahiye, I did SR-ship for 3 years. Then I was inclined towards gynae-oncology, so I did my SR-ship for 2 years in gynae-oncology also. So I worked in gynae-oncology for good 3 to 4 years. But I did fellowship in endoscopy, gynecology and gynecological endoscopy from World Laparoscopy Hospital. But that was a short course only. But I was doing endoscopy because since I was involved in big corporate hospitals, I was working with big corporate hospitals, so I was doing endoscopy continuously. So then I got this offer in Artemis. So I joined as a consultant obstetric gynecology in Artemis last year only, in 2019.
Okay.
I've been working. I started my own private practice also, so I'm doing both.
Okay. No, that's really nice to know. So when now when you have been practicing since the last so many years, what are the positives and challenges that you want to mention about the field? What have you faced till now as challenges, and what are the positive things that on an everyday basis that you feel?
See, first I'll talk about positive things. So start with positive things. So much of negativity now. So as such, obstetric and gynae is a very happy branch. No, you deliver kids, so you're blessed. You get sweets and everything. It's a happy go branch. Now people who want to settle in peripheries or who they go to their hometown and they want to settle there, it's a good branch because it's a sort of terminal branch. Like in medicine you have to do DM, in surgery you have to do MCH. In today's world you need to do this.
Yes.
But in Obs Gynae, even if you don't do anything and you set up your own practice in your hometowns, in peripheries, in normal small cities, then it is good to go. You're good to go. You'll earn good income. You'll have a good life, right? Your practice will settle in few years. But bad thing is that there are a lot of emergencies. There is lot of hard work involved. For same amount of money, you have to do lots and lots of hard work. There is tension because you are involved with two lives, mother and fetus at same time.
Yes.
So if any complication happens, then there are complications in every field, no. But if anything happens, then it is like a much terror.
Yes.
So, and you have to run for emergencies day and night. There is no schedule. So this is only the thing. And yes, the financial returns involved are not as great as in super specialized branches.
Obviously. True. Yes, that's true. I understand that part. Although it is something with maybe it is good for people who want to settle in tier 2 towns.
And that is for sure. They have a good life. They can set up their own. Even if you settle a small setup like small nursing home, then it is okay. You no need to spend many years. for those people who want to settle in their hometowns, they should start their practice as early as possible. So they'll settle in few 3, 4, 5 years. They'll settle. But for metro, who want to settle in metro cities, big cities, the road is too long.
Okay.
Then you have to go for in certain you have to do certain super specializations here also.
Yes,
so
yes.
we have around 5, 6 branches, 5, 6 fields where you can wherein you can go after passing MS, Obs and Gynae. So you can you can see endoscopy, Gynae endoscopy is must for all. It is not that if you are practicing simple Obs and Gynae, or you are doing IVF, or you are doing Gynae onco or fetal medicine, you can escape from Gynae endoscopy. Gynae endoscopy is must for all now. So I will advise all the MBBS people who want to pursue MS Obs Gynae as their career, they should do endoscopy courses just after passing their MS Obs Gynae.
Okay.
So for endoscopy courses, there are 2 types of courses. Short courses are available like 1 month, 15 days.
Yes. Please continue.
But but I will advise that if you really want to learn endoscopy, then you should do long courses. No, for minimum of 1 to 2 years. And then you can learn in depth. Right? So there are certain courses that are available in India. You can do, one is AIMS. You have 2 years fellowship in FNB program. You have 2 years fellowship in AIMS. But since the seats are very less, so very less people they go through it.
Yes.
Then you have this certain fellowship 1 year long courses. They are available in Bangalore, Kochi, then Ahmedabad, Allahabad, Agra, and in Delhi NCR also.
Okay. So all of these are for the laparoscopic courses, basically.
Yeah.
And this is according to Dr. Parvinder, this is a must that you have to go for.
That is must, and you cannot escape from endoscopy nowadays.
Yes. And so what are the other things that a person should, what are the other branches out of laparoscopy? Like you have also practiced oncology. How important is onco, and how was your experience in onco-gynae?
See, gynae oncology as a branch, it is a good branch because it doesn't have emergency, because you can operate, you can plan your cases in day, and you just finish your cases and you go, right? You don't have emergencies in that. It is a highly specialized branch, and you need to be in good hospital settings. You need to have a good team over there, oncology team over there. And for gynae oncology now, so MCH gynae oncology is also there. If someone wants to pursue gynae oncology, that person should straightway after passing MS or DNB, whatever, they should go for MCH courses. They are available in AIMS, full 3 long year course. They are available in AIMS. That is available in Tata, and there are good. Even DNB gynae oncology has come up now. There is DNB in gynae oncology, so it is now well recognized branch. Earlier, surgical oncology people used to do gynae oncology only, but now gynae oncology is altogether separate and good entity, right? So DNP gynae oncology, it is available in Delhi also. Rajiv Gandhi Cancer Hospital is there. Fortis Memorial Cancer Institute is there, and Gujarat GCRI. So you can opt for DNP. And also fellowships, 1 year or 2 year fellowships, they're available in gynae oncology in Bangalore, Kidwai Institute, and Gujarat Cancer Research Institute, and Rajiv Gandhi also. So, but this gynae oncology as such is slightly depressing branch.
Yes,
you see terminally ill patients. Sometimes you cannot do anything about them. You cannot cure them. You see bad advanced cancer cases, swelling, and they are having ulcers, and you cannot do much about them. So it is slightly
depressing.
You can say depressing. Yes, it is not as happy as you are delivering a kid. No.
Yes.
But then again, you don't have to do emergencies in this. But there are long surgeries, 5 to 6 hours. You have to stand. You have to operate. That much patience you need to have. Yes. And this is a highly skilled branch. It involves a great skill.
No, that's true. You have to adjust somewhere. But I believe this branch must be only available in metros. I don't think so. It's in tier 2 towns because you need so much of.
Yeah, it is available in metros only, but slowly and slowly it's an upcoming branch. No?
Okay. Okay.
It is
Okay.
available in good cities. It is available.
Okay. Okay. And apart from that, you have told us about 2 branches, laparoscopic, oncology. Then what are the other branches that people can pursue after MD or
There is
MS?
one reproductive medicine, that is IVF, infertility courses.
Hmm.
Then we have fetal medicine also. And
Okay.
one we have urogynecology also, urogynecology. So
Okay.
urogynecology, they can be picked as usually urologists do it, but now gynae people, they are also endowed. They can also go for urogynae. There is full one, you have this super specialization course available in AIMS. You
Okay.
have to pass an entrance test and
Hmm.
then you can do that course in AIMS.
Okay.
Urogynecology. Then
Neurogynecology.
we have fetal medicine. You have DNB, FNB, DM in fetal medicine. There
Yes.
are courses available. So
Yes.
fetal medicine again, it is a specialized branch wherein you have basically you deal with all treatment and management, and you have to screen. Basically, you have to screen, and then you can manage also those fetal congenital anomalies, fetal complications. You have to do fetal echo, ultrasound, detail ultrasound. So it is
Okay.
also this branch is also in
Specialized. Hmm.
metros. Yeah.
Mm-hmm. So,
Then reproductive medicine, so it is no everybody knows about it. IVF is there.
IVF, yes, reproductive medicine. And I think so. Reproductive medicine, IVF is also one compulsory branch that people need to do nowadays for their practice, isn't it? Post
No,
like.
you can't say that it is compulsory. Yeah, because it's a part of Obs Gynae. Because see, when there is an infertile couple, usually they go to an obstetrician or gynecologist,
Yes,
right?
yes, yes.
So the initial part, that is just managing the, you can say, the they can just diagnose the things, they can manage the things. There's certain initial part, ovulation, induction, and all things they can be managed by simple obstetrician and gynecology. But
Yes.
when it comes to IVF, that
Hmm.
is, you have to do embryo transfer, you have to induce, and those
Hmm.
specialized things, they are to be done by specialized person only.
Okay.
Simple obstetrician and
Not
gynecologists,
do
they
that.
can, but nowadays when everybody has a super specialization course available,
Hmm.
then they go to a, then one should go to a particular people who is specialized in that, who is
Hmm.
well trained in that actually.
Yes, yes, yes. Yes. And people tend to do that, to go to the IVF specialist people only.
Yeah, there are IVF centers available all over.
Hmm.
Even in small cities, you can see the IVF centers they are set up.
Yes, yes, yes.
So
True.
they cater with their special needs only.
Hmm.
And I think this should be done. You should be, when there are special needs, you should be going to their special center only.
Yes, yes. And that makes things easier for the patients also to
And the
understand where to
things,
go
they
to.
are well balanced. They are well in, they are organized in a well way. No,
Hmm,
that
hmm,
is very important.
hmm. Yes. But when it comes to IVF, if somebody wants to learn about IVF, what are the best places to go and learn about it?
See, there are a lot of courses even nowadays. Nowadays, the DM is also is there. Reproductive medicine DM is also there, available in AIMS. Full 3-year course. We have DNB in reproductive medicine, and then there are fellowships available in
Hmm.
South, like in Bangalore, Kochi. There are good fellowships available around for 1 to 2 years.
Okay.
There is IIR Institute of Reproductive Health and Sciences in Bangalore.
Okay.
So if you go to Foxy website, Foxy recognized courses,
Okay.
both for endoscopy and infertility, you can get a good list online where you can wherein you can apply for these courses.
Okay. Okay. And these are online courses, the fellowships and all? No,
No, no, no, no.
they are offline.
You can apply online. You can search for them
Okay.
online, but you have
Okay.
to go into
You have to
nothing.
go. Okay. Because you told me, so I was like, let me inquire, is it online or
No,
not?
no. Medical field cannot be online. You have to
Yeah.
go and you have to
You
you
have
have
to
to
learn
train
hands-on.
yourself. Yeah.
Yes, you have to learn hands-on. True. So when it comes to, you have already mentioned that there are a lot of courses going in AIMS and as well as in South. What are the best places international also where people, for example, if there is fetal medicine, if somebody wants to pursue fetal medicine, I understand there is a branch in AIMS. Are there any good institutes international also if somebody wants to go and
Yes, yes. So for fetal medicine, there are institute, John Hopkins Institute is there. In London, there are 2 to 3
Yes.
colleges for fetal medicine. They're available. For endoscopy, the most common, like we people, many of our colleagues, they have gone to Kiel Institute, Germany.
Okay. Okay.
So there are good colleges there. They are in London and all Germany. Even for gynae oncology, there are fellowships available in Canada,
Okay.
in Finland,
Hmm.
England, and Singapore. 1 year good fellowship is available in Singapore.
Mm-hmm, mm-hmm. So, one more thing. If I want to pursue after my MD, I want to pursue in any of the branches. What will you suggest? Is it better to go outside and to get a better exposure? Does it help in your exposure for example, I pick up an endoscopic course in Germany that you mentioned in Kiel in
Yeah,
Germany.
yeah,
It helps in your exposure.
yeah. It truly helps. Yeah, it truly helps. See, I'm not saying that there are not good institutes in India. There are very good institutes in India, like
Hmm.
AIMS, like in South Bangalore, Kochi. They give you good hands-on training.
Hmm.
But you should be there for 1 to 2 years. I'm stressing on that.
Yes.
Don't go for short courses. Okay,
Okay.
never go for short courses. Go for long courses, like 2 years courses.
Hmm.
Then they give you good hands-on. But yes, the courses available outside India, they give you much better exposure. They
Hmm.
are more practical. They are more associated with research work. No,
Hmm. 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 Yes, yes, yes. And how long? These courses are also of the same duration, is it?
yeah, 1 year,
1 year.
around
Around 1 year.
1 to 2 years. Yes.
So when
Even months observerships are also available.
okay,
3 to 6 months.
okay. So now if we mention that we are planning to do our any of our fellowship or in any branch abroad outside India, do these courses also help you to practice there after clearing their basic examinations?
There in outside.
Yes, yes, yes.
That you have to inquire because no, for practicing you need to have an MS Obs Gynae degree
Yes.
from their respective countries. So
I believe you have to clear their basic examination.
basic exams, yes.
And are those degrees also eligible here? Do people do you
If
know?
you have passed your MS Obs Gynae or DNB Obs Gynae from India, then it is fellowship courses. The super specialization courses, they are okay. They are accepted here. But
Okay,
you need to have your basic Obs Gynae degree.
Obs Gynae from here. Okay,
Yeah, yeah.
okay. Then that's good. Because at times it gets difficult if you're not.
Super specialization, if you have done fellowship from some other country and you have done your basic obs and gynae degree from India, then they are well recognized.
Well and good. Okay.
But they are given added value actually.
They give you added value, and that helps you with your everything, with your confidence also, I believe. Because we are being exposed to so much of research work. So
Because see, you could get
hmm.
yeah,
Yeah.
that is
So now when we have mentioned so many different branches where people can actually practice and go after their MS, now where should a person practice, private or government? This is a very important
yeah.
question
See,
that in their mind.
what I used to tell my DNB students in this Artemis hospital also, that you should be focused. What you want to do after your super specialization, this specialization. If you want to settle in a government institute, or you do want to do a this private practice. If you want to settle in a government institute, then you need to, like, just when you do your basic obs and gynae degree, you should do your SR shift from a hospital where it gives you teaching experience for 3 years. Okay, you need to have a teaching experience,
Hmm.
right? Then you can apply for an assistant professor degree and then associate and so on. You'll get into these good government institutions. And plus you need to have a lot of publications, research work, because that is required to join these government institutions,
Hmm.
right?
Hmm. Hmm.
So then, see, what is the plus point of government institutions? You need not to build your own. You need not. You can, even if you don't build your own private practice, then it is okay,
Hmm.
right?
Hmm.
You go into government is there. That is a fixed 9 to 5 job, or you will have certain fixed night shifts. That's all.
Hmm. Hmm.
Right? But the disadvantage is, of course, our Indian government institutions, some AIMS and all, they have all the things there. They have laparoscopy, everything is available.
Yes.
But certain other government institutions, they are lacking in advanced things.
Yes. Yes.
They have basic structure for deliveries and all.
Mhm.
But if you think that you want to do certain advanced surgeries there, good surgeries, good techniques, they have minimal resources. No. So then you will not be able to practice those advanced things, or you will not be able to do those advanced surgeries. But then yes, your life will be like easy, because you don't have to go, like when you do private practice, you do practice in hospital, then you come to your home, then you have to go, you have to sit in your clinic for good 3 to 4 hours, build up your practice and everything. No, it involves a lot of hard work.
Yes. Yes.
So you should be very much focused what you want in your life.
True.
But the chances to grow as a person, as a doctor, they are more in private hospital rather than in government. Except if you are in really top institutions of India, that's a different story. And if you want to go for a private practice, again, as I said earlier, you should know where you are going to settle. If you are going to settle in your hometowns, then it is okay. Settle there as soon as possible. Go there, set up your practice, and start doing it. Start learning things side by side. Start learning endoscopy side by side. Start learning IVF if you want to side by side, and set up your practice. Because if you will have patients only, then you will get anything. You need to have your own clientage.
Yes.
Right.
Yes.
In metros, if you want to practice, then you have, if you want to do a super specialization practice, you want to practice a certain field only, then go for that, whether IVF, gynae-oncology, fetal medicine, urogynae, whatever you wish. Otherwise, there also you have to start your practice and be attached to a good hospital. That's it. But it is a long journey in big metro cities. It is a long road to go.
True, because maybe because of the competition also present.
Yeah, because Obs and Gynae, see, when you go for when in my old days, when I was applying for a senior residency in government institutes. So in anesthesia, all seats used to be vacant. Or radiology, all seats used to be vacant. If anybody wants to join a government institution as an anesthetist, they could easily join it. But Obs and Gynae, they were big lines. For one seat, there were 300 to 400 participants. The competition is there.
Competition is there. Maybe Obs Gynae is a field
that a hell lot of competition there.
Because of the clinical part of Obs Gynae, people tend to pick it up during their MS, I believe.
But now, see, if you really wish to do it, then you go for it. But otherwise, now more branches are available. Pathology and pharmacology, microbiology, they are also good branches.
Now opportunities actually build up with those.
Yeah.
Yes, maybe 10 years down the line there were less opportunities with these non-clinical branches, but now there are a lot of opportunities with them as well. Yeah. So now, one more thing I wanted to ask. We have discussed so many branches, neurogynae, gynae-onco, laparoscopic, the reproductive, and many. Which of the branch will you suggest? Obviously, this is according to one's feel as well towards some of them. But there must be some of the branches which are doing really well, which are coming up, which are the good branches that are having.
Again, this depends where you wish to settle. I'm again saying. Yes. If you are going to your hometown, and you are specialized in fetal medicine, it will take time for people to recognize and that yes, you are doing something like fetal medicine. They don't understand the importance of fetal medicine, right? But if you are settling in metros, then yes, fetal medicine, gynae-oncology, they are good branches. They are good upcoming branches.
Okay. So these two branches.
There's one more branch. Actually, one more fellowship available. I didn't discuss. That is in high risk pregnancy. That is available in Hyderabad and Mamsi. But high risk pregnancy, usually general obstetrician and gynecologists, they also
tend to
deal
do
with
that.
high risk pregnancies.
Maybe they get experience to do that because of handling
Yeah,
some.
if you wish to get more trained in those things, then you can join that also.
Okay, okay. So from where did you do your laparoscopy course? Because I
I
know.
have done it. See, I was doing my laparoscopy just after I passed my MS Obs Gynae, because I was attached. I told you I was attached to certain big private institutions, so I was doing laparoscopy over there.
Okay,
So I just needed, you can say, short training. So I did my training from World Laparoscopy Hospital, Gurgaon.
okay, okay, okay. That's nice. You know, that is the advantage of metros maybe in your practice, that you got exposed to so many of different fields and different kind of experiences. So it was really nice talking to you about all of this, about deep into the branches, what to do, what not to do, which is the upcoming. For people who are in the iffy mode right now, what to do and where to do, this will definitely help them. Thank you so much. And also, what is it something that you want to tell these people who are doing their MS or who are planning to do their MS in Obs Gynae after their MBBS? Anything that you want?
My advice would be that please be clear what do you want to do. Just ऐसे नहीं करना कि अभी ये मिल रहा opportunity ये join कर ले. No, don't do that. ठीक है? Please be clear that you want to settle here or you want to do a super specialization. If you want to go for a super specialization, do it as soon as you pass your basic degree. Don't waste your years. Right? And if you think that I don't want to go for a super specialization course, then please start your practice. Because when you build your practice, then any good hospital will take you. Right? Any good hospital will take you and do your super specialization course side by side. And if you want to go to government hospital, you want to have a simple, balanced life, shanti wali zindagi, hai na? Then you start focusing on your research work, your publications, and you join a teaching hospital where you can get a teaching experience. That will help you in getting into these big government institutions.
Yes. That's so interesting.
That's what I want to tell all people.
Yes. No, that's really nice, because as a student you don't understand this, what to do, what are the good things that will
It
help
took me, I think it took me 10 to 15 years to understand this, because there was nobody.
Yes. No, I'm sure. And then, it's with you and it's with every doctor. Every doctor has a journey to
Basically, it
understand.
is more with females, I'll say, because more females, more girls, that they take MS Obs Gynae,
Yes.
So, and they have their own family issues and everything. But I will say that please be clear. These family issues and everything they will settle, but you should be clear that what you want to do.
Yes, that's true. Because if you figure that part early, things get settled. Otherwise, things go round and round and round and round. I know. So that's really nice. It's really insightful, and I'm sure people must be very much clear now with what they want to do after listening to you. Thank you so much, doctor. I really loved the conversation with you.
Thank you. Same here. I'm really thankful to you for having me here.
It's our pleasure, actually, and I'm also so glad to know about all of the insights. I also didn't know about all of this, and it's nice to know through your experience all of this. Thank you so much to come on the platform. And all of you who have gained knowledge from this amazing interview, please do share it with your friends and your colleagues. I'm sure there are people out there who want to know about it and who will get a track in their career with all of this knowledge. As well as stay tuned with our next interview next Sunday at 11 a.m. We will be there with another interesting topic, with another interesting person, and that will also add something to your career, to your life. Thank you so much. Thank you so much, doctor.
Thank you.
Yeah.
Bye. Good day.
Yeah.